Medical billing processes are being sufficiently automated at a rapid pace, with more doctors, hospitals, and medical facilities switching to secure online patient management system. According to Harvard Business Review, the healthcare industry accounts for 30% of all the electronic data storage around the world. A large part of this is in the form of unstructured data filled with the key medical facts and information. RCM companies have invested in setting up the foundational building blocks of analytics, emerging technologies, compiled with the advance in computing power, offers the next step for the organization to drive insight and improve the financial and operational performance. Now, while medical billing softwares is an important part of any practice, providers run into a large inefficiencies and problems with their software. The reason is that the adaptability and the full integration with their current technologies. There are 750 billion rejections per annum. 250 billion is the admin cost because of the insufficiency of the system. And there's a lot of disconnectivity and the workflow. And there's medical coding and training program that needs to be done for all these providers. Now, what I think and what the future should be. So the future of medical billing is that as today, healthcare system becomes more value-based, new technologies in healthcare need to be utilized at a scale of the organization to leverage emerging technologies like blockchain, artificial intelligence, and cloud computing to improve the performance and the outcome. Now, if we talk about blockchain technology in healthcare billing, blockchain can provide powerful solutions to minimize medical billing related frauds. Blockchain contains an inbuilt identity mechanism, a cryptography, secure public, private, and key pair to use to associate activity on the network with a specific participants. This would ensure each penny paid is tracked by automating the majority of the claim adjudication and payment process activities. Blockchain system could help eliminate with traditional and clearinghouse to reconcile the current layer of the system. Now, the other important element is robotic process automation. With PRA, health insurance eligibility check can be automated with the retrieval of the coverage data from the insurance sites, catching potential eligibility issues early in the revenue cycle. If the provider needs to rework 500 claims per month, it would require more FTEs who can work in a day or two on the new claims. This could be automated by robotic process automation, scripts resulting in rejection, automating payer calling for details, determining coding mistakes, refiling the claims, or filing an appeal. Now, I would say that big data and analytics solves the revenue leakage. This would be the biggest contribution to the revenue cycle management, as the primary object of an RCM company is to augment the billing process in such a way that a healthcare provider can run a profitable practice. Now, registration data, clinician data, financial data, and claim data are high in a volume and require extensive mining of data. As per HFMA, out of the 1.4 billion claims submitted annually, 200 million are denied out of every 7, which costs around $5 to $10 million each year. Now, big data technology can be used for RCM data integration, management and processing. Denial rates can be reduced or even eliminated through RCM big data analytics. Now, the most important role artificial intelligence can play, and this is where the future is actually, that healthcare data, when compiled with efficient algorithm, can provide deep insight and knowledge around improving different RCM processes, machine learning algorithm, and natural language process. Algorithm can be applied to applications such as intelligent alert of denial risk, medical coding error, deduction, claims, administration accounts, receivables, and denial and the recovery of the claims. Also, this can help the healthcare providers to, to help them with their claim automation and one chip record, which can be introduced to the current current system that is out there. Now, every year, a lot of healthcare providers lose so much money, or there's a lot of administration burden because of the current processes. Thank you. If you have any questions, inquiries, I'll be more than happy to answer.
Thank you, Ghafoor Ahmed, founder and CEO of AGA Medical Billing Services. Please pop your questions into the chat box if you have any questions there for Ghafoor. And we'll just have a chat now about some of the things that you've been talking about. And you mentioned one of the key things there was the amount of money lost due to inefficiencies. Is this because people don't understand the technology that's available to them, do you think?
Yeah, I think it's not only because of the technology. Yes, one is that they're not aware of the technology. Second important thing is a lot of doctors, especially the physicians who are running the practices, are not really tech driven, or not really into the technology, because their main focus is to make sure they're treating the patients right. And this part is broken. The billing part is broken. And I would say that it is because of most people are not aware of the technologies. They're not adopting the new technologies and the changes in the system. And the second thing is because they have a less stuff, like they don't have proper medical coders and medical billers in place. That could be one of the reasons.
Do you think that's a fear of change, a fear of new technology, and a fear of what's coming ahead?
Yeah, I would say fear of changing, adoption of new technologies, I would call it.
Yeah, and these billing systems, are they easy to operate? Are they would they actually save time if they were implemented in the correct way?
Well, very good question. So mostly there are legacy systems out there from 90s and 2000s, right? So they're not really up to date. So I don't say that. The platform they're not using, they are using the platform, but they're really outdated in legacy systems. Now, with us as a company, Claim.ai, what we've introduced is a very latest technologies, AI-driven platforms called Claim.ai, which is basically we simplify the whole entire process for the physicians, because in those legacy system you will get to see so many options out there and you get lost. So what we came up with is with a new technology which is completely AI driven. We use data science pretty much for claim scrubbing, and we have the Elasticsearch in place, very latest technology which helps healthcare providers to eliminate the rejection, because the system is smart. It automatically deducts the error. It automates, like most of the things. What the system does is automatically does it by itself, rather than you have a human interference, and there's a lot of human errors in between. So our system does most of the things automated for the providers, and yeah, this is one of the things that actually helps them reduce the rejection.
Yeah, and you mentioned a huge amount of claims denied there. I mean, that those claims denied, the cost that surrounds that, surely the cost of implementation of a goods billing system would far outweigh the loss of monies from the claims denied.
Yeah, I mean, this could be prevent because with the latest system that has been introduced in the industry. As you said, the biggest problem is adoption of new technology, right? So, like for example, if a physician has been using a system for 3 to 4 years or 5 years, for them to change, it's a lot of work, to be honest. Like literally they need to train, and they don't, like I don't call it they're lazy enough, but I think it when there's a change, it takes time, for the new adoption. So I think if they will get into this smart platform that we're introducing currently, is going to make their life really easy. Not only this, but the money lost, but there's a revenue loss which is huge. You can imagine $252 billion annually rejections because of the human error, because of the systems are not efficient, and healthcare providers suffer because of that.
And this artificial intelligence, really, it is able to make those decisions and take that room for error away. Is that correct?
That is correct, exactly. With a big data and with a machine learning algorithm, yes, definitely, it is overcoming that.
So how do you convince organizations and medical practitioners to actually make that change? What would you say to them are the huge benefits to making those changes?
Well, I could say that currently we are experiencing that ourselves in the market, that when you show them the statistics and the real-time data and the real-time dashboard, and you can literally show them how much money they're losing, everyone wakes up literally. But then again, obviously there are a lot of decision makers involved. They cannot make like a decision right away. But yeah, I think now the awareness is out there, especially when it comes of losing revenue, and you show the track record of what they have done in the past year, what they have done currently, and the kind of revenue they're losing. Yeah, they kind of wake up, and I could say that it's now people start realizing in the industry we need to adapt to a smart technology.
Absolutely. I think smart technology is where the future is, and especially with AI. The medical practices, the organizations that they've got these legacy systems in place, and we've already said they fear change, they don't like change. So what's the sort of, can these systems be implemented into any size of organization, or are they just for the big organizations with large amounts of data?
Well, the current platform that we introduce is for everybody. It can be a small, medium, single, standalone pharmacy, or a clinic or a hospital, to group of pharmacies or group of chain of hospital for a larger enterprise level. It's available for everyone.
And we heard about earlier on this morning, we had one of our presenters talked about cyber hacking and all those sorts of things. How safe are these AI systems, do you think?
Well, I think if you compare it to the legacy systems or the systems in 90s or 80s or 20s even, the cloud-based AI systems are, when it comes to cybersecurity, it's like, I would say there's 80 to 90% is very secured, because the way they have built it, keeping all this cyber attacks in mind. And I think I would say it's like 80 to 90% more secure than the legacy systems.
Thank you for that. So what's your biggest challenge now, do you think, going forward?
Well, I think for us the biggest challenge, because we're in the MENA region, and we're literally going to the whole entire GCC market. We are now in Saudi as well. So for us is the biggest challenge right now is the adoption. To be honest, it's gonna take a bit of time, but for us the biggest challenge right now is to changing people to the new technology and adoption of introducing them to the latest technology, and for them to accept the change and adopt the system.
So for our audience today, what thought would you like to leave them with for today? What's the one thing you would like them to take action on after leaving this presentation today?
Yeah, I would say for the healthcare providers, especially people with clinics, hospitals, pharmacies, laboratories, anybody in healthcare space, I would say that they should be open to adopt the new technologies. especially any system that's AI driven. There's machine learning involved. They should be open to it, because if they are going to encourage these systems, it's gonna be efficient. Like, everyone's life is gonna be much more easier. It's gonna, as I said, on blockchain, it can detect a lot of frauds, abuse, which happens in healthcare claims management. So these things are gonna make their life a little easy. So I would say be open to accept the new technology, especially anything related to AI and ML.
Well, that brings us to a close. I'd like to thank you for your time and for answering my questions. Thank you for your presentation. That's Ghafoor Ahmad, founder and CEO of AGA Medical Billing Services. Thank you.
Thanks for having me. Appreciate it.
So that brings us to a close. That's the end of our presentations for today and the close of Arab Health Week. I hope you've enjoyed all the presentations over the last three days. And don't forget, if you've missed them, they are on the Future Health YouTube channel, and you can watch anything you've missed, or you can rewatch anything you are particularly interested in. Thank you to all of our excellent speakers and presenters. I'd also like to thank you for attending and for your valuable input and questions throughout the 3 days. Please remember to continue those conversations, those connections, those collaborations, and don't forget to arrange those important follow-up meetings to continue to network globally.